A federal judge could decide this week whether to lift the Title 42 immigration policy.
That's right. The judge says he will issue his ruling before Monday, the 23rd, when the policy is set to expire. The CDC announced in April it was ending the public health policy, saying it's no longer necessary given the current state of the pandemic and resources available to fight COVID-19. But proponents of the bill say healthcare and law enforcement systems would be overwhelmed by an influx of migrants if the policy ended.
CBS News immigration reporter Camilo Montoya-Galvez joins us now from Mission, Texas, with more on this. Camilo, welcome. You spoke with DHS Chief Medical Officer Dr. Pritesh Gandhi today while touring a Border Patrol facility. He spoke to you about the vaccine program there and why it's so important to get people at the border vaccinated. Let's listen to what he had to say.
What we're able to do here is give a dose of vaccine that will prevent downstream use of hospitals, right? I mean, if we're able to ensure that people get their first dose here and they have some modicum of protection, we're able to ensure that hospital beds don't get used in towns that may need that extra bed, right? And so, we're building it with this COVID vaccine here, and I'm hopeful later this year we'll be able to add on the flu vaccine.
Camilo, can you tell us about the program at the border there and what you saw today?
Hi, Marla. Yes, this is a massive migrant vaccination campaign. Dr. Pritesh Gandhi told us today that the Department of Homeland Security has already vaccinated thousands of migrants and asylum seekers in U.S. border custody since this operation began in late March. All migrant adults and families traveling with minor children who are not expelled to Mexico or to their home countries, under the Title 42 pandemic restrictions are now being offered COVID-19 vaccination. And they're being counseled to take this vaccine if they don't have prior proof of vaccination in their home countries. We saw these vaccinations firsthand at the Central Processing Center in McAllen, Texas. These migrants receive a dose of the vaccine by nurses contracted by CBP, and then they are monitored for 30 minutes to make sure that they don't have any negative symptoms that may require medical attention. And Dr. Gandhi stressed that this vaccination campaign is not just designed to protect the health of migrants, but to protect the health of DHS personnel at the border and the broader American public. Because remember, Mola, that many of these migrants and asylum seekers are released into U.S. communities to continue with their court cases.
And, Camilo, you also asked the doctor about the baby formula shortage, which, the whole country is feeling, and also the migrants there at the border in these facilities. So how are the facilities responding to it? That's what you wanted to know. Let's listen to the doctor's response.
We are talking about children, young children and babies. I'm a pediatrician. I've practiced medicine here in the state of Texas. We have a responsibility to follow our national values to ensure that individuals that we take care of, no matter whether it's here, outside of here, in McAllen, in El Paso, or elsewhere, that we treat individuals on American soil with dignity and respect. We follow the laws of this country, we follow the values of our country, and that's what we're doing here.
So, Camilo, it's clear where he stands on the values, but what are the laws that he's talking about?
Yeah, it's important to set the record straight here, Tanya. There is a settlement agreement known as the Flores Court Settlement dating back to 1997 that has required Republican and Democratic administration to provide basic necessities to migrant children in U.S. custody, including age-appropriate food, and that would obviously include formula for babies and infants, and Customs and Border Protection rules also direct agents to provide formula for babies. And beyond these rules, I think there would be constitutional concerns if any lawmaker would propose to starve babies in U.S. custody, because the Constitution, as you know, Tanya, bars cruel and unusual punishments of people in U.S. custody. And Dr. Pritesh Gandhi told us that beyond these legal questions, this is the right thing to do to make sure that these migrants, whether they're going to be deported or released or detained, have access to food and basic necessities while they're in U.S. custody.
All right. Camilo Montoya-Galvez, thank you so much for your reporting there in Mission, Texas.